first responder trained in basic life support. You are on a jogging trail in the woods and you come across a woman on the trail. 1. Your first action is to A. Establish unresponsiveness. B. Ensure scene safety. C. Feel for a pulse. D. Begin CPR. Correct answer, B. Ensure scene safety. In any situation, you must first determine the scene is safe for the victim and you. You quickly scan the surroundings and determine that there are no threats. 2. The next step you should take is to A. Establish unresponsiveness. B. Check for a pulse and breathing. C. Begin CPR. D. Begin rescue breathing. Correct answer, A. Establish unresponsiveness. You tap the woman and ask her if she can hear you. You determine that the victim is not responsive. 3. The next step you should take is to A. Begin CPR. B. Activate the emergency response system. C. Begin rescue breathing. D. Attempt to bring the victim up to a sitting position to provide a better airway. Correct answer, B. Activate the emergency response system. Since you are alone, call for help or use your phone to call the emergency response system. 4. The next step you should take is to A. Begin CPR. B. Monitor the victim until someone else arrives. C. Check for a pulse and breathing. D. Begin rescue breathing. Correct answer, C. Check for a pulse and breathing. Since you are trained in BLS, you should do these actions simultaneously and for no longer than 10 seconds. As you check the pulse and breathing, you note that she is not breathing and does not have a pulse. 5. At this point you should A. Begin CPR. B. Continue to monitor the victim. C. Begin rescue breathing. D. Attempt to bring the victim up to a sitting position to provide a better airway. Correct answer, A. Begin CPR. Since you are trained in BLS, you should provide full CPR beginning with compressions. An untrained individual can provide compressions-only CPR. 6. You begin a cycle of high-quality CPR. You know that a cycle of CPR includes A. 30 compressions in 1 breath. B. 30 compressions in 2 breaths. C. 20 compressions in 1 breath. D. 20 compressions and 2 breaths. Correct answer, B. 30 compressions and 2 breaths. 7. High-quality CPR includes all of the following except A. Compression rate of 100 to 120 per minute. B. Compression depth of 2 to 2.4 inches for an adult. C. Full chest recoil between compressions. D. Pausing for a pulse and breathing check after the first 20 compressions. Correct answer, D. You should not pause CPR for this check. You continue cycles of CPR. EMS arrives within a few minutes to take over treatment and transport the victim to the hospital.